have such real power. Just how are you? Good. All is well?
Senator, how are you?
Well. How are y'all doing?
Excellent.
Social distancing.
The mayor usually
How you doing, Dave?
Are you going to speak? Yeah. Are you going to speak to Lisa?
Hey, Lisa. Now, Dave, is that high def makeup or? Oh, yeah. Hey, good, good. Now we gotta have the right mood. No, and no force rounds either. Okay. All right, here we go. Right, here you go.
You guys ready? All right, we'll go ahead and get started. Good afternoon, I'm Palm Beach County Mayor Dave Kerner, and I'm joined here with other local leaders involved in the response to COVID-19. I want to share with you some important details as we've committed to doing throughout this entire process, ensuring the quick delivery of accurate and useful information with regard to our community. First of all, I want to ensure the members of the county, the safety of you and your families. The community is the highest priority of the leaders and everybody in this community, and we all share that belief. As you will recall, we declared a state of emergency on Friday, March 13th. On March 19th, that state of emergency was extended for an additional 7 days here in Palm Beach County. Today, the governor released 3 executive orders regarding to the public health emergency of COVID-19. These orders address Palm Beach County and Broward closures, the operation of alcohol sales, restaurants and gyms, and the conduct of local government public meetings. These executive orders may be found on our website at www.pbcgov.org. Our protective actions are on a regional approach, meaning that the majority of cases in Florida are within the Tri-County, Palm Beach, Broward, and Miami-Dade areas. Right now, the latest information indicates that there are 113 cases in Miami-Dade, 124 cases in Broward County. And as Miami-Dade County invoked emergency protective measures shutting down beaches, bars, and large gathering areas, the wave of people from that order, which was previously released, has that effect of pushing those residents and visitors to the northern counties, including Broward and Palm Beach. Both Broward County leadership and Palm Beach County leadership discussed the impact of that phenomenon and the people coming to our area, and that would have a significant impact on our population and our public safety as well. Accordingly, we have been working with the governor's office and the leadership of Broward County over the last couple of days to ensure that we have a regional approach to public safety and the restrictions that come with these orders. I'll go briefly over Executive Order 2070, and that is an order that orders all beaches to close in Palm Beach County and Broward County. It orders all movie theaters, concert houses, auditoriums, playhouses, bowling alleys, arcades, gymnasiums, and fitness studios to close. I'll say that again because I know there's been a lot of questions and some confusion about some language in these orders that does not exist. So let me clarify what this order does. It closes all beaches in Palm Beach County and Broward County, and it orders all movie theaters, concert houses, auditoriums, playhouses, bowling alleys, arcades, gymnasiums, fitness studios closed. Those are the specific entities that will have to be shut down for this time period. It does not apply to gym and fitness centers, which are amenities to a hotel that have a capacity of 10 or less. Second, there's Executive Order 2071, which applies statewide and specifically addresses alcohol sales in restaurants. The order imposes a restriction on all restaurants and food establishments licensed under the Chapter 500 and Chapter 509 Florida statutes, and it orders to suspend on-premise food consumption for customers. Food establishments may continue to operate their kitchens for purposes of providing delivery or takeout services, and that's a concept that we've much adapted to already here in Palm Beach County of our own volition. It also orders that all vendors licensed to sell alcohol for beverage consumption on the premises to suspend that sale and buy the drink in a sealed container for consumption on the premises. Such vendors may continue to sell alcoholic beverages in sealed containers for consumption off premises. Again, the idea is that we do not want to sell alcohol in a place where people congregate. As an adult, you can use it, drink it at home, but we're not going to congregate in restaurants and have a drink together. Closure of gymnasiums and fitness centers within the state are also identified with more specificity in that order. Now, at this time, it's my pleasure to turn the microphone over to Dr. Alina Alonso. Again, the Department of Health continues to be a very effective working partner with the county government and the lead agency here in the state of Florida in the COVID-19 response. It's a delight to be here with Dr. Alonso. We are maintaining our social distancing, so you'll see behind me the officials of our county. It's not that we've grown not to like each other over these last few weeks. We really are trying to implement the strong procedures that the Department of Health has recommended and ordered. Doctor? All righty, thank you.
Good afternoon. As you can see, we're trying to practice what we preach. I've got 2 sons. I've got to do that all the time. So next time I see you all, I expect you to learn the lesson and you guys be 6 feet apart from each other also, okay? That's for the press. We continue to work very closely with our state, federal, and local health partners here to limit the spread of COVID-19. We're working diligently to appropriately identify, treat, and isolate this virus. We continue to stress that everyone plays a part in lowering the impact within our communities. We need to lower them in our workplaces by practicing social distancing to impede the spread of this virus. I'm going to mention once again what social distancing means. It means washing your hands, using sanitizers with at least 60% alcohol if you can't use the soap and water. Avoid bringing your hands to your face because that's how you're going to catch it. You're going to bring it into your eyes, your nose, your mouth, and that's how you're going to get the virus inside. You're going to avoid people who are sick. You're going to stay home when you are sick, and you're going to try to maintain that 6 feet away from others. We want everyone doing this. We also want you to avoid large crowds because it's almost impossible when you're in a large crowd to stay away from each other. And continue to use the hotline, the 1-866-779-6121 for general information. And you can go to we have a new website site that's easier to remember. It's all one word, Florida Health COVID-19, no hyphen. So Florida Health, COVID-19.gov. As of 1:45, our last update that I have on March 20th, there are a total of 34 confirmed cases in Palm Beach County. 29 of them are Palm Beach residents. 1 is a resident who is outside of Florida, and we have 4 people here in Palm Beach County that are non-Palm Beach residents. 22 of them are men and 12 are women. There have been no deaths in Palm Beach County. We're very grateful for that. In terms of the travel information, that's very important. Right now, we have 15 cases that are related to travel outside of the United States. 6 have no travel relation, and 13 have unknown cause for their coming into contact with the COVID-19. That means that we have 19 cases that have no relationship to travel or to a positive person. That's the definition of community spread, that there's no identification of a positive or a travel-related cause. So therefore, at this time, we have what is called community spread of the virus. This means that these people who have become positive are in our community, and we expect higher numbers to start appearing now because of this community transfer. That is natural. That's nothing that anybody's done wrong. That's how this virus is supposed to behave. We knew that was coming. We know the numbers will get greater. I want everyone to remember that emergencies start local and end local. So while we hope to get help from the feds, we know that that help to us is slow. And we know that once this is over and the feds go away, we will still have to be dealing with this. This is a long term. This may take several years. H1N1, I've repeated it probably at every conference, every press conference, took 3 years to finally the numbers go down. So this is a long-term event that we're going to be in. The biggest challenge that we're facing right now is making it possible for you to get a test if you have symptoms. Let me explain the word test, because that has been confusing to the public and for information. Getting a test actually takes 2 steps. First, you need to have a sample taken from your nose and the back of your throat. That sample then has to be shipped off to a lab where they actually run the test. Anyone with symptoms should call their provider and then make an appointment to go to their office. The provider will instruct you on precautions that you need to take before you go to their office. At that time, it's the physician, it's your provider or your ARNP or whoever it is that your provider is that will determine whether or not to test you. They may be able to take the sample right in their office. If not, you can be given a prescription and take it to another facility that actually does the sampling and the testing. That's what folks are having difficulty finding right now. While the test results should take between 24 to 48 hours to actually do a test, what we're seeing is a backlog at the labs. So some people are hearing that their test could take as long as 8 days. We're presently working with commercial labs that are willing to provide the drive-through swabbing that other people are hearing about, or any kind of swabbing and testing locally. If we are able to do that, that will drastically reduce the wait time for the results, and it will alleviate the concerns in the provider's office of not being able to get their patients tested. It's also important to remember that at this time, there's no proven antiviral or medications to treat this virus. The medical trials that some of you have been hearing on the media or on different outlets will take quite a bit of time before they can actually be used commercially. So at this time, I want the public to understand that the most important thing to be done is the social distancing. We cannot say that enough times. Everybody has to participate in this. The closing of some of these facilities will help keep people away from large crowds, but it's still a personal decision that everybody in this community has to make so that they help each other and they help all of us. We can do this if we all practice these simple steps to stop spread of the disease.
Thank you, Doctor. All right, it's our distinct pleasure to welcome to the podium Sheriff Rick Bradshaw. He's going to speak to some of the law enforcement issues surrounding COVID-19 response. Sheriff, thank you.
Thank you. Just a few issues I want to clear up that we're getting phone calls about. First of all, the curfew. We have not anticipated we're going to do a countywide curfew. If in fact that comes on our radar screen, it'll be a conversation between myself, the commissioners, the county manager, and we'll contact other municipalities. But right now, we do not anticipate that happening anytime soon. The question also came to us, are you going to release prisoners from jail? We've seen other county sheriffs do that. The answer is unequivocally no. I am not releasing anybody from the jail. They're in there for a reason, and they're going to stay there. We did have a conference call this morning. The state attorney and the public defender will have a conversation about maybe reducing some bonds, but that's something I'll let the state attorney talk about. We also had a question about is the sheriff's office going to overlook some minor crimes out there? The answer to that is no. Obey the law. I have plenty of room in the jail, so go by what the law is. We're not turning our backs on anything that's happening out here. We're going to be out here enforcing the law just like we do in any other crisis. We're fully prepared to do that. We're going to be out here. One thing we are not going to do is enforce any eviction notices that have been served. We're not going to remove anybody from their house, at least for a 30 or 60-day period till this thing can level off. We're not going to do any evictions. There is some emails that are going around out there now, and the email basically says, I have a friend that's high up in the government. We understand that the president's going to order a nationwide lockdown. The National Guard's being activated behind the scenes. That is a bogus email. If you get that, do not pay any attention to it. I can guarantee you, if there's anything nationally going to be done with a lockdown, the regional domestic security chairmen like myself throughout this state and the United States will certainly know about it ahead of time. And the last scam that's out there that I want to make sure everybody's aware of, and this happened in Broward, we haven't had one here yet, is some people are showing up, knocking on the door. They have white coats and a mask on. They said they're from the health department. They're there to test you, and it's going to cost $100. That's a scam, folks. The health department's not coming to your house to test you, so don't fall for that. Pay attention to our website and our social media. We have the latest update on any scams that are out there and any information that's going on. So if you got a question, call. But be assured, we're out here, we're ready to go, and we're going to be out here protecting you regardless of what the circumstances are.
All right, it's my pleasure to welcome to the podium now the Chief of Palm Beach County Fire Rescue, Chief Reginald Dern. Thank you.
Thank you, Mayor. Good afternoon, community. I want to say, first of all, thank you for your continued cooperation in helping us keep this community safe, and how important it is that we follow all the direction given to us by Dr. Alonzo to keep this community as safe as possible. Palm Beach County Fire Rescue and the few hundred firefighters and paramedics we have throughout this county are doing everything in their power to keep us safe. We ask that you help us, work with us, be forthcoming in your circumstances and your conditions. Nothing's going to impact us giving you the service that you deserve, what this community needs. We're going to be there for you, still respond to every call. I want to say thank you personally to every firefighter throughout this county on all they do, because they face the same challenges each of you do on a daily basis, yet they continue to work and provide the services we deserve. Thank you.
Thank you, Chief. All right, we have, just so you know, we have 5 more speakers, and we're running up on a 4:30 deadline, really, for the governor's press conference. So I'm going to call now to the stand State Attorney Dave Arenberg.
Good afternoon. I'm Dave Arenberg, State Attorney for Palm Beach County. A couple things. The sheriff and I received pictures of markets locally selling things with prices that are much higher than they used to be. We had received a picture that the sheriff sent me of allegedly of a local market selling toilet paper for $42. That would be price gouging. If the picture is authenticated, that would be price gouging. I urge all Palm Beach County residents, if you see that kind of activity, report it to the price gouging hotline, which is 1-866-9-NO-SCAM, 1-866-9-NO-SCAM. I realize there's some confusion out there from some businesses as to what constitutes price gouging. What you do is you take the reported price of an essential commodity or service during the state of emergency, and then you compare it to the average price charged over the prior 30-day period. If there's a gross disparity between the prior price and the current price, it's price gouging. And if you're wondering what an essential commodity is, it's things like toilet paper, hand sanitizer. So we urge our corporate citizens to please abide by the laws and be good neighbors. Now, as far as the court system, the Florida Supreme Court has suspended all jury trials through mid-April, which means that jury duty is also suspended until further notice. As of this Monday, March 23rd, misdemeanors and criminal traffic court hearings that are in the next 30 days will be reset for 60 days. So if you're a defendant in a misdemeanor or a criminal traffic case, and I'm not talking about speeding or texting while driving or parking tickets, we're talking about criminal traffic cases, then the clerk of courts will notify you of your new court date. That includes misdemeanor and criminal traffic hearings scheduled for next week, even if you haven't yet received your notice. Well, lastly, because crime never sleeps, even during a pandemic, our office is in court 365 days a year. We're there to protect public safety. We are open just like local police are open to keep the community safe. And so I'm just asking us all to be good neighbors. We have been through multiple hurricanes, we've been through multiple states of emergency, and we will get through this as well. Thank you.
Thank you, State Attorney. We have up next Dorothy Jacks, our property appraiser. She'll speak to some of the unique issues that her office is responding to. Thank you, Dorothy.
Thank you, Mayor. Good afternoon. Just very quickly, I want to make you all aware that the property appraiser's offices in our 5 service centers are going to close to walk-in traffic starting on Monday. This will allow us to focus our services on online and telephone communication with the public. People continue to purchase homes, which is a very good thing, but we want to encourage them to use our services such as filing for homestead exemption by calling us or emailing us. We'll provide them with applications online or on the phone and get them to them so that they're able to continue to conduct business with us. Our office is very focused on completing our tax roll work that we have to do. This, of course, leads toward being able to collect revenue that will run our municipalities and the county for next year. So we do feel that our services are vitally important to keep moving. We have not received any information from the state that our deadlines will be extended, which is understandable, given the need to raise revenue at the end of the year. So we will continue to work and get all of the new construction added to the property tax roll and keep processing people's exemptions. We appreciate your support getting that information out to the community. We also want to make sure that our staff are safe, and they are. They're working hard. They're doing really exceptional professional service through this difficult time. Thank you very much. I'd like to thank the county commissioner certainly and the county administrator for their support. We are all working well together as a team. I think you can be proud of Palm Beach County. Thank you very much.
Thank you, Dorothy. And now we'll invite up to the podium Ann Gannon, our constitutional tax collector.
Good afternoon. I'm here today to announce that we have closed all of our 6 tax collector service centers to the public. Last year, we served over 800,000 people in person, and that's almost 70,000 people each month that come in our office. We must do everything we can to protect our community and slow the spread of this virus. At the same time, we understand how critical it is to provide services to the public. And this year, we're collecting $4.2 billion in property taxes to fund these services. The collection and distribution of property taxes is vitally important, especially during these times. As you know, these taxes fund critical issues in our county: public safety and emergency programs, healthcare programs, school district, Children's Services Council, and frankly, the county staff and all of our staffs are funded through the collection of taxes. And for these reasons, we will continue to serve the public and our community through all other means available, mainly our online, palmbeachcounty.com or pbctax.com, mail, email, and phones. These are extraordinary times with many unknowns and constant change. We will continue to keep our clients and the community up to date, and I personally want to thank all 320 of my dedicated employees who are at work every day serving the public. And I'd also like to thank the commissioners and the county administrator and the staff for including us in the discussions about this virus and how we can best meet this challenge in our county. Thank you.
Thank you, Ann. And now we'll call to the podium a statewide leader and something that we're very appreciative that you're here today, Senator Bobby Powell, to give us some state information. Senator, thank you.
Thank you. Yesterday, we had the opportunity in Tallahassee to pass a nearly $93 billion budget. In that budget, we included $52.5 million to deal with the coronavirus, 27 million of that directly from the federal funds, and then 25 million, which will be state funds. We do anticipate that there will be an opportunity or responsibility of the state to expend more money as we see what's currently happening. The good thing is we prepared for this. We have money in the reserves to prepare for a crisis like this. In addition to that, we are continuing. I talked to the Surgeon General yesterday. One of my roles, not only as a state senator here, but I also serve as the chair of the Florida Legislative Black Caucus. Myself and several of my colleagues had a call with Surgeon General Scott Rivkees yesterday, and in that, Surgeon General Rivkees indicated that Palm Beach County, Broward, and Dade counties were experiencing the highest number of cases, but he also indicated that Broward County and Dade County had done a substantial number of tests, quite a bit more than Palm Beach County. In regard to that, the information was also given that the symptoms are, once again, a runny nose is not a symptom of corona. The symptoms are a dry cough and a fever. Many people have called about a runny nose, and once again, to reiterate what Dr. Alonso said, if you feel like you have this, make sure you call your doctor first before going, because you have the potential to spread this virus. From the state level, we're asking everyone to continue practicing social distancing, as well as continuing to wash your hands for at least 20 seconds in warm water. As far as my office goes, we are operational, but we have also closed to walk-in traffic. We are still responding to phone calls and fielding calls, in addition to unemployment assistance, which has been one of the #1 calls people have been talking about, calling our office about, and the business loan, the bridge program. So if people have questions, please don't hesitate. If you cannot reach the Department of Emergency Management or Department of Health, my office and several of the legislators are still operational. Call us and we'll be able to cut through some of the red tape. Once again, we want to reiterate the points that have been made: social distancing and continuing to wash your hands. Thank you.
Thank you, Senator. And our final speaker for this press conference will be the tip of our spear, the County Executive and County Administrator, Virginia Baker. She'll have some important points, and then we'll let you get to the Governor's press conference. Thank you.
Thank you, Mayor. Good afternoon. I'd like to thank the media. Some of you have been very good partners to our community by keeping them calm. And I think most important, that's what we must do. We must stay calm and we must be prepared. We must take the necessary precautions that you have consistently heard. So I just want to thank you for that effort. This is an unprecedented time that we're in with COVID-19. We're constantly changing. Our new information comes out every single day, and so we must reassess and continue to provide you with the utmost newest information. The county has modified the way that we provide some of our services. Some of them we have limited public access into the buildings. However, we've also made adjustments so that we can provide the services that our clients still need. In addition to that, we have also worked with our building division on how we're accepting plans. We have gone to having them submit certain plans online. Others are being dropped off. We want to protect the public. We want to protect our employees. Some of our parks systems have been modified and programs have been modified. I'm going to refer you directly to our pbcgov.com website. It will have all of the detailed information on there. We will be constantly updating that information. You may also call our EIC, which is our Emergency Information Center. That number is 561-712-6400. I want us to realize that some of the decisions, very difficult decisions we've had to make on what is closing to our public, our restaurants, some of our other entertainment type areas, those were very, very difficult decisions to make because that is someone's livelihood. And so they feed their family by working. So we're going to be working here in the county with community partners to make sure that we're making things available to these individuals. And we want them to know that we did not do this lightly. We understand what challenges they have, and we'll continue to work with them. I'd like to refer those that have lost their job and they're looking for employment to Career Source. So look that up, and they will be available to assist you in any way that they can. Also, for businesses that are looking for loans, as the senator stated, the state has opened its state's bridge loan, and that is loans to for-profit businesses that provides up to $50,000 for one-year interest loans, free loans. And the application deadline is May 8th, 2020. The SBA Disaster Assistance Program is also opening up. It's going to take a minute for that particular program to be up and running, and that is why the governor opened up the small bridge loan. The county also has a Section 108 loan that we will work with you on applying for. In addition, we've got a $75,000 micro loan program that we will work with you on. So please do not hesitate to go to the county's website, and all of this information is available. Thank you.
Thank you, Virginia. Just to recap, I want to make clear that the members and residents of Palm Beach County know, because there was some point of confusion on this, that based upon these two orders, there are some more restrictions. Our beaches will be closing, for example. Gyms will be closing. Some of the recreational outlets that we're used to and probably need now more than ever will be closing, but our park system is generally open. Golf courses will remain open. But specifically with concern to private industry and business, the vast majority of businesses, offices, law offices, doctors' offices, things of that nature, will be allowed to remain open. But like anything, we ask that you use your common sense and spirit of civic duty to enforce the social distancing efforts that have helped us keep that curve pushed to the right, flatten that curve. We've heard that a lot. In the three-county, tri-county area, we have the lowest amount of viruses, and I do, in some way, in my heart, attribute that to the hard work of our constituents. So please, as we move forward, rely on factual information. If we're speaking to you as county officials, we will be factual and honest with you, but if you're getting it from the internet, be cautious. We've learned that time and time again, and know that we will all get through this together. It's just going to take some hard work and some awkward work too, and we're going to find, we're going to find that this community has and will continue to respond very forcefully to any threat. With that, I encourage you to tune into the governor's conference. I'm sure he has some important updates, and thank you to everybody for your hard work. I'm happy to take questions. I don't want to interfere with other important information that needs to get out. So if you're watching the governor's, if one of you can tell me when it's on, I'd like to stop at that point. So, questions?
Yes, Mayor, has the health department calculated the number of ventilators available in the county? Do we have that number? Is there a concern that it may or may not be sufficient?
I'm going to speak for Dr. Lonzo. I can speak to that unless you want to speak specifically. We have an ongoing process of working with our doctors and surgery centers and CEOs of hospitals to know precisely how many ventilators are in the county. As to projections as to whether that need has been fulfilled, I won't comment on. Time will tell as this envelops. I'm sure we're well prepared, though, in that regard.
Are we aware of the number now, sir?
With a level of specificity, yes. I'm not going to speak to that specific number. I think it's an irrelevant one, but we're marshaling all our resources. We're working with DEM at the state level, who's ordered thousands and thousands of them, and the federal government's going to assist as well. Thank you. That's in effect at the time of signing, right? Yeah, so it is in effect under the governor's jurisdiction, and it'll be enforced like any other time of emergency by our law enforcement officers that are patrolling the area constantly. And we'll probably have specific focus. Was there anything beyond that, Sheriff, that you wanted to speak to? All right.
And if the sheriff is able to speak to this, have deputies been using notice to appear versus making arrests for misdemeanor cases to reduce the number going to jail?
Nope, if you would have listened to what I just said earlier, we're business as usual. If it demands an NTA, then we're going to give them an NTA. If it demands an arrest, they're going to be arrested.
Are there plans for the county to partner with more healthcare facilities to open up more drive-up testing facilities?
I can't speak to that. Yeah.
We're working with all the community partners. Many labs have approached us. We need labs that are able to do the swabbing and the testing all in one. Many people have come up to us, but they want us to give them the testing material. We can't do that, so that's not useful. They have to bring the whole shebang. Otherwise, we're just repurposing the stuff that we're getting.
In terms of community spread, because I know it's being looked at in Broward, it's possibly being enacted in Miami-Dade, is the goal to perhaps have some kind of large-scale testing facility like what's being done in Broward because we have evidence of community spread?
That would be ideal, but I think, again, in this community, we've tried to take the services to where the people are, so we might think of something, because we have such the largest county per square miles, we would ideally have something in the north, something in the middle, and something in the south, but that all depends on what we're able, but we're working with anybody that's available to do that, that brings everything with them so we can do those services to folks.
Have you been in contact with the governor to use the National Guard for something like that?
They're always available to us, and they would be willing. Obviously, the places that are more prominent right now, that have more need, are going to get more attention. We're in that same area, and the idea of putting it in Broward makes sense because it's in the middle. So if people from either side can also take advantage of the location that's in Broward.
Any other questions? If not, thank you. We'll notify you for our next press conference. Have a good day.
Senator Howard,